membrane and the auditory tube. Okay, eustachian tube or auditory tube and tympanic membrane is important short note or part of long question. Okay, so you prepare these two very carefully. So first we will discuss the different divisions of ear. So ear is a organ of hearing and human ear is more sensitive to sound frequency ranging between 15,000 to 3,000 hertz. Okay. These are the three parts of ear: external ear, middle ear and the internal ear. Okay. We will see the different parts. See, this is outer ear, pinna or auricle. Okay, this canal, this is known as ear canal or external auditory meatus. Here is the tympanic membrane. Okay, this part is forming the middle ear. Within the middle ear, three small bones you can see. This is malleus. Here is the incus. Here is the stapes. Okay, malleus, incus, and stapes. Stapes is the smallest bone in our body, and this stapes is connected to inner ear. This is cochlea and vestibule. These parts are forming the inner ear. From there, the vestibulocochlear nerve is originating and forming the eighth cranial nerve entering into the cranial cavity. Okay, so these are the different parts. From up to the tympanic membrane, this whole of the part is forming the external ear. Tympanic membrane is forming lateral wall of this lateral wall of this middle ear. Middle ear is a box-shaped structure. It has 6-sided. We will see later. So it is forming the lateral wall. It has middle ear has medial wall is formed by the inner ear or cochlea. Lateral wall formed by tympanic membrane. There is also anterior wall, posterior wall, superior and inferior wall. Okay, so these are the different divisions of the ear. See here, this part, this is tympanic membrane, external auditory meatus. Here is the auricle or pinna. These parts are forming external ear. Here is the middle ear cavity. It is three bones you can see: malleus, incus and stapes. A handle of the malleus is attached to the almost near the middle of the tympanic membrane. And tympanic membrane is concave from outside and convex from inside. Okay, and this point of attachment of the handle of malleus with the tympanic membrane, this part is known as umbo. Okay, and these are the other different walls: superior wall or roof, inferior wall or floor. There is also anterior and posterior wall. And here you can see this is the auditory tube or eustachian tube, which is connecting the middle ear with the pharynx. Okay. And here it is via the foot plate of stapes and round window. This middle ear is connected with this internal ear. Here is the vestibule and this is cochlea. Okay, and these are connected to eighth cranial nerve. From there, the cells are going through the eighth cranial nerve. So first we will discuss the external ear. External ear consists of the auricle and external acoustic meatus. The ear canal is starting here. So auricular pinna, it is a single piece of yellow elastic cartilage and continuous with cartilaginous part of the external acoustic meatus. This part is formed by yellow elastic cartilage. Absent in the lobule of ear. In the lobule of ear, the cartilage is absent. That's why the ear piercing is done generally in this lobule. Okay. Now, what are the different features of the auricle? First is helix. Outer this convex part, this part is known as the helix. Then antihelix, parallel to the helix and on its inner aspect. This part, this curved-like structure is known as antihelix. Next is tragus. Here, this elevation, here at the junction of face, this is tragus. Okay, and this elevation is known as antitragus. It is also lying parallel to tragus. Then concha. Concha is the bony part, mainly inner bony part. Here lies the bony part of the external ear. This part is known as concha. Then is Simba concha. Okay, this is also lying near this concha in this region. Next is scaphoid fossa. The deep depression in this region is known as the scaphoid fossa. Then triangular fossa. Here above this concha in this area, this depression is known as triangular fossa. Next is lobule. Here in the lower part of ear where the cartilage is absent, this part is known as ear lobule. So these are the different parts of the external ear. Next we go to the muscles of the auricle. They have extrinsic muscles and intrinsic muscles. Extrinsic muscles move the auricle as a whole. These are three muscles: auricularis superior, auricularis posterior, and auricularis anterior. Here you can see auricularis superior, here is auricularis posterior, here is auricularis anterior. These are the three muscles of auricle. Extrinsic muscles helps in moving the auricle. Intrinsic muscles modify the shape of the pinna. Okay, within the pinna lies these intrinsic muscles. These are helicis major, helicis minor, tragicus, antitragicus, transversus auriculi, obliquus auriculi. These are the intrinsic muscles of the auricle or pinna. Okay. Now they help in modify the shape of the pinna. Now the nerve supply. Nerve supply of these muscles is temporal branch and posterior auricular branches of the facial nerve. So this is nerve supply of these different muscles. Now we go to the, after the pinna, we enter into the external auditory meatus or auditory canal. So what is the extent? From the bottom of the concha to the tympanic membrane. See, this part is concha, you have learnt in previous picture. So from the bottom of the concha up to the tympanic membrane, this part is known as external auditory meatus. Okay. What length is about 24 millimeter. It is shorter in child. These lengths are asked in your MCQ questions. Okay. Lengths are important. Now what are the subdivisions? Cartilaginous part is formed by lateral 1/3. It is almost 8 millimeter, and bony part is formed by medial 2/3. It is about 16 millimeter. So these are the two different parts of the external acoustic meatus. Lateral 1/3 is cartilaginous and medial 2/3 is bony, that is 16 millimeter in length. Okay. Now it has two ends, lateral end and medial end. Lateral end is formed by bottom of the concha. Medial end is formed by tympanic sulcus. One sulcus is present here where the tympanic membrane is attached. Okay. So medial end there is presence of tympanic sulcus for tympanic membrane attached obliquely here. Next is roof and floor. This upper part is roof, lower part here is the floor. Next there is anterior wall and posterior wall. Okay. Posterior wall lined by skin continuous with the cuticular layer of the tympanic membrane. Tympanic membrane develops from all the three germ layers, ectoderm, endoderm, mesoderm. Outer one is ectoderm, which is forming the cuticular layer. Okay. And this cuticular layer, that means mainly this is like the skin, lining of the skin. So this cuticular layer is continuous with the posterior wall of the external auditory meatus. Next is ceruminous glands are present here, which secretes cerumen. To cerumen is like wax, ear wax is formed by these ceruminous glands to prevent the maceration of the epithelium and warm, humid, and keeps the ear canal warm, humid for effective vibration of the tympanic membrane. Okay, so these are the functions. Now we go to the blood supply. It is supplied by anterior auricular or superficial temporal artery, posterior auricular or external. It is a branch from the external carotid. These are branch. Anterior auricular is branch from superficial temporal. Posterior auricular and deep auricular. Posterior auricular is branch from external carotid artery and deep auricular is branch from maxillary artery. So these are the blood supply of the external auditory canal. Next you go to the venous drainage, drain into external jugular vein, maxillary vein and pterygoid plexus of veins. Next we go to nerve supply. The roof and anterior wall, it is supplied by auriculotemporal nerve. Okay, and these two are continuous with each other, roof and anterior wall. And floor and posterior wall, it is also continuous and these are supplied by auricular branch of vagus, Alderman's nerve. Okay, so this is nerve supply of the external auditory canal. Next, some applied aspect of the external auditory canal. Okay, otitis externa, that is infection or inflammation of the external auditory meatus, that is known as otitis externa. Okay, earwax formation also occurs here by the ceruminous gland, but normally when the skin is extended outward, the cells are continuously moving outward and earwax is thrown out. Okay, but if this process does not occur, there will be collection of wax within the external auditory meatus. Okay, so earwax will irritate the auricular branch of vagus, that is Alderman's nerve, and it will lead to vomiting and coughing. Okay, these are the symptoms. What is the treatment? Dewax or syringing the ear with warm water is advisable. Always you have to use warm water, because why cold water is not used? This is important. Explain why question. In your ENT, it can come. So cold water will induce cardiac arrest by stimulating the vagus nerve. Okay, vagus nerve is also supplying the heart, and here also we have got some cutaneous supply of the vagus nerve. So if you stimulate the vagus nerve by cold water, there is chance of cardiac arrest. That's why you have to use warm water for syringing. See, this is syringing process is being done. Okay, with a large syringe full of warm water, you have to push the water into the ear canal and the water will come out along with the wax. Okay, with the force of water. And there is also foreign body can be inserted. You have to remove the foreign body with some okay, there is. So this part is external auditory meatus. After that, here is the eardrum or tympanic membrane. Next we go to middle ear. Eardrum is part of the middle ear. So middle ear is a box-shaped structure mainly. It has six sided and it has a lateral wall or tympanic membrane has been removed. Okay, medial wall you can see a promontory. There is plexus of nerves, tympanic plexus of glossopharyngeal nerve. Here is the anterior wall. There is a, in the anterior wall there is a canal for tensor tympani, and below there is pharyngotympanic tube or auditory tube is attached to this anterior wall. And here is the posterior wall. In the posterior wall here is pyramidal prominence, and this is the prominence of lateral semicircular canal, and this is the course of facial nerve. Facial nerve lying in this medial wall and posterior wall of the middle ear. Okay, and below the and inferior wall there is a prominence for the jugular bulb. This is internal jugular vein. This is forming superior bulb just below the inferior wall. Okay, understood. Next, these are the three ear ossicles. These are removed from the cadavers. Okay, malleus. Here is the malleus, incus, and the stapes. Okay, so malleus has two processes: anterior process, lateral process. One is handle of medius. Here is the head and neck of the malleus. Okay, so this handle of the malleus is attached to the tympanic membrane, and this head articulates with this incus. This is articular. This is a facet where it articulates with the malleus. Malleus has also a long limb and a short limb, and this long limb is attached with this head of the stapes. Stapes has a head and two limbs and a foot plate or base of the stapes. Foot plate is covering the oval window. Okay, so these are the three ear ossicles lying within the middle ear. See here, malleus, incus, and stapes. See, this is tympanic membrane. This is the tympanic sulcus, and this transparent structure you can see. This is tympanic membrane. This you will see if you see from outside. Okay, via the external auditory canal, and in the middle. And if you place light, the light reflection of light you will see in the anterior inferior quadrant. The light cone of light will appear in the tympanic membrane, and this tympanic membrane is forming an angle. You can see tympanic membrane is not straight vertically, not present vertically. It is forming an angle of about 55 degree with the external auditory canal. Okay, understood? And this is the reflection of handle of the malleus, and it will form a prominence or convexity on the inner aspect of the tympanic membrane, that is known as umbo. So next we go to the tympanic membrane or eardrum. It is very frequently given in your long question. Okay, from here mainly this tympanic membrane, auditory tube or inner ear can come, or middle ear also can come. You have to write all the six walls middle ear if middle ear comes as a long question. Okay, so tympanic membrane or eardrum, it is a oval. Here you can see it is a oval, semi-transparent, pearly gray trilaminar membrane and separates the middle ear from the external ear. Measurements are 9 to 10 millimeter diameter maximum and 8 to 9 millimeter is minimum diameter. Oval, as it is oval. So position, it is placed obliquely, 55-degree angle with the floor of the external acoustic meatus. You have seen in previous picture angulation. In newborn, it is almost horizontal. Okay. Next, peripheral margin of the membrane, there is a fibrocartilaginous ring. Okay, and this ring is attached to this tympanic sulcus within the bone, temporal bone. And tympanic sulcus is deficient above. Anterior posterior malleolar folds attached to the lateral process of the malleus. These folds are known as anterior and posterior malleolar fold. They are attached to the lateral process of the malleus. This is lateral process and this is handle of the malleus, and here you can see part of the incus. Okay, long process of the incus where the stapes is attached. So what are the subdivisions? You practice a schematic diagram of tympanic membrane like this. Okay. If it comes as a long question, you have to draw a diagram. So subdivision, it has two parts, pars flaccida and pars tensa. This upper small part above this handle of malleus, in between the above these two folds, malleolar fold, anterior malleolar fold, posterior malleolar fold, going to be attached to the lateral process of malleus. The part above this malleolar fold, this part is known as pars flaccida, and the part below it is forming the pars tensa. Okay, so surfaces. So two subdivisions, two surfaces. Lateral surface is concave and medial surface is convex. Most convex region is no umbo. This part is umbo where handle of malleus is attached. Next, between the fibrous and mucous layer, three layers we have discussed. One is cuticular layer, outermost continuous with skin. Middle is the fibrous layer, inner is the mucous layer. Okay, so in between the fibrous and mucous layer, handle of malleus is lying, and in this layer is crossed medially the tympanic nerve. Okay, now structure. Three layers are present. Outer cuticular layer, it is keratinized, hairless, devoid of dermal papilla. Okay, so this is outermost layer. Next is intermediate fibrous layer. Outer radiating and inner circular fibers are present in this layer. And inner mucous layer, simple columnar or squamous lining is present in this inner mucous layer. Okay, understood? Next, we go to the arterial supply, supplied by deep auricular artery, stylomastoid artery, and anterior tympanic artery. Deep auricular or anterior tympanic branch from maxillary artery, and stylomastoid artery branch from posterior auricular artery. So this is arterial supply. Venous drainage, outer layer drains into external jugular vein, and inner layer drain into transverse sinus and pterygoid plexus. So this is venous drainage of the tympanic membrane. Okay. Next we go to the nerve supply. So cuticular layer, outer skin or continuous with skin, this layer is supplied by auriculotemporal nerve in the upper and anterior part, and auricular branch of vagus in the lower and posterior part. Next is mucous layer. Mucous layer is innermost layer. It is supplied by the tympanic plexus formed by the glossopharyngeal nerve fiber and sympathetic fibers. Here you can see this is tympanic plexus. It is lying within above the cochlear eminence and also supplying the inner mucous layer formed by the glossopharyngeal nerve and coming from sympathetic plexus. Sympathetic plexus also forming a plexus around the internal carotid artery. Next, we go to the external examination of tympanic membrane. Cone of life, it is reflected in the antero-inferior quadrant here. Antero-inferior quadrant, cone of light you can see. And handle of the malleus and long process of incus can be seen from the outer aspect. Now applied aspect, okay. Myringotomy. Myringotomy is incision given in the tympanic membrane to release pus. Okay, if pus collection occurs in the middle wall, to release the tension, so a small incision is given over the tympanic membrane. This is important for your ENT and also can come as a explain why. Okay, so incision is given in the posterior-inferior quadrant here in this quadrant. This is antero-inferior, here is the posterior-inferior quadrant. Incision is given for myringotomy. Also in some infection or injury, perforation of tympanic membrane can occur and treatment of perforation is tympanoplasty. Okay, you have to take graft can be taken from the deep fascia, can be taken from mainly from the temporal fossa. Okay, fossa covering the temporalis muscle here near the temple. This is taken because it is nearby to the ear, and also there is less chance. This is a good graft material for tympanic membrane. So temporal fossa is taken and it is placed at the position of the tympanic membrane. This operation is known as tympanoplasty. It is done in perforation of tympanic membrane. Now we go to the anterior. So tympanic membrane was forming the lateral wall of the middle ear. Now we go to the anterior wall. Anterior wall of the middle ear has a carotid canal here, carotid canal in the lower part, and in the upper part it it is also known as carotid wall because the internal carotid artery is lying in close relation. It has in the upper part two bony canals separated by a bony partition. Upper one is for the canal for tensor tympani. This is tensor tympani muscle is entering into the middle ear. An auditory tube. This is opening of the auditory tube or eustachian tube. Okay, bony part. And in the lower part, bony carotid canal. Here lies the bony carotid canal. Internal carotid artery surrounded by sympathetic plexus is lying here and pierced by superior and inferior caroticotympanic vessels and nerve. Here you can see the piercing of the nerves and vessels. Okay, so tympanic membrane we have covered, and from the anterior wall, in the anterior wall you have seen the opening of eustachian tube. Eustachian tube we will discuss now in details. Okay, it is also important long question, auditory tube or eustachian tube. Okay, also can come as a short note. So auditory tube, also known as pharyngotympanic tube or eustachian tube. Auditory tube is a trumpet shaped channel. See, this is middle ear cavity, external ear, external acoustic meatus, tympanic membrane, malleus incus stapes, inner ear here, and this part is the middle ear. So middle ear is connected via this eustachian tube with the pharynx. Okay, pharyngeal opening of eustachian tube you have seen in head neck section. So eustachian tube have a lateral osseous part and medial bony part. Lateral osseous part is 1/3, medial cartilaginous part is 2/3. Okay. So auditory tube you can see from this shape. It is a trumpet shaped channel which connects the nasopharynx with the tympanic cavity. This tympanic cavity, here is the nasopharynx connected by the auditory tube. What is the function? It maintains the equilibrium of air pressure on either side of the tympanic membrane. Okay, so outer air coming from external auditory meatus, and here on the inner aspect air is coming from pharynx. If there is blockage of this tube, there will be imbalance between the air pressure and there will be sound production due to the difference in pressure. So function is it maintains equilibrium of air pressure on either side of tympanic membrane for proper vibration of sound. Length is about 36 millimeter long. Direction you can see auditory tube is directed downward, forward and medially and forms an angle of 45 degree with the sagittal plane and 30 degree with the horizontal plane. Okay, sagittal plane 45 degree with the horizontal plane 30 degree. Now what are the parts of the eustachian tube? It is divided into two parts. Bony or osseous part, it is posterolateral part, forms 1/3 of the tube. It is 12 millimeter long. Another is cartilaginous part, it is anteromedial part and forms the 2/3 of the tube and it is about 24 millimeter long. Isthmus, it is meeting point of bony and cartilaginous parts of auditory tube and it is the narrowest part of the tube. Okay, understood? See here, this is the section of auditory tube. It is formed by cartilaginous part of the auditory tube. Okay, here is the osseous part. See, this is auditory tube, bony part, cartilaginous part. Two muscles are attached over the cartilaginous part, levator valli palatini and salpingopharyngeus. Okay, here it is connected to middle ear, bony part, and above the bony part, here is canal for tensor tympani, and this is cartilaginous part. U-shaped cartilage is present, and this opening is traversed by one membrane. So, definition, it is a trumpet-shaped channel between nasopharynx tympanic cavity, 36 millimeter long. Parts are bony part, posterolateral 12 millimeter long, and cartilaginous part, anteromedial 24 millimeter long. Isthmus is the narrowest part, meeting point between bony and cartilaginous part. What are the ends? Medial end and lateral end. Medial end is large, slit-like, 1.25 centimeter behind the posterior end of inferior nasal concha. Lateral end, it opens at the anterior wall of the middle ear. Supply, arterial supply and venous drainage. Arterial supply by ascending pharyngeal artery, middle meningeal artery, artery to pterygoid canal. Venous drainage by pharyngeal and pterygoid plexus of veins. Innervation by the pharyngeal branch of pterygopalatine ganglion. Nervus spinosus, tympanic branch of glossopharyngeal nerve. And function, it maintains the equilibrium of air pressure on either side of tympanic membrane. It drains the middle ear. Okay. So this bony part of auditory tube lies in the petrous part of temporal bone. Its lateral end is wide and opens at the anterior wall of the middle ear. Cartilaginous part of auditory tube lies in the sulcus tubi, which is a groove between the greater wing of sphenoid and apex of the petrous part of temporal bone. This sulcus tubi you have seen on the inferior aspect of base of the skull. Okay. And this part of auditory tube has a superior and medial walls formed by the triangular plate of curved elastic cartilage. Apex of triangular plate is attached to the medial end of the bony part, and its base is free and forms a tubal elevation in the nasopharynx. Lateral wall and floor is formed by fibrous membrane. Levator valli palatini originates from its inferior aspect. Okay. Ends of the tube, medial or pharyngeal end is large, vertical, slit-like opening, and it is situated in the lateral wall of nasopharynx, about 1.25 centimeter behind the posterior end of inferior nasal concha. This opening you have seen during head neck. And lateral or tympanic end, it is smaller, opens at the anterior wall of middle ear. Next is lining epithelium. Pharyngotympanic tube is lined by pseudostratified ciliated columnar epithelium with interspersed goblet cells, and the cilia of the epithelium beats towards the nasopharynx and thus help to drain the secretions from the middle ear cavity. Okay, so its function is maintaining the air pressure on two sides, and also there is secretion is drained into the nasopharynx via this beating of cilia present here. Blood supplies by ascending pharyngeal artery, middle meningeal artery, artery to pterygoid canal supply the auditory tube. Next is venous blood from the auditory tube is drained into the pharyngeal and pterygoid plexus of veins. So this is blood supply. Innervation by pharyngeal branch of pterygopalatine ganglion supply the tubal opening. Nervus spinosus, which is branch of mandibular nerve, supply the cartilaginous part, and tympanic branch of glossopharyngeal nerve supplies the bony part. Functions, it maintains equilibrium of air pressure on either side of tympanic membrane, drains the secretions of middle ear, and functions are very frequently asked. Okay, and by opening of the tube, it protects the middle ear during swallowing, yawning, and sneezing. Okay. So auditory tube in children, it is 18 millimeter. Okay, in adult you have seen it is 36 millimeter, but in children it is 18 millimeter long, and it is shorter, it is wider and more horizontally placed. So tubal elevation is less prominent in children. And as the auditory tube is shorter and more horizontal in infants, infection can easily spread from nasopharynx to the middle ear. Okay, and hence the middle ear infection are more common in children than in adults. This is very frequently given. Explain why question. Why infection is more common in children than the adults. Middle ear infection. Okay, middle ear infection more common in children because the auditory tube is shorter in length and more horizontally placed. So it is also known as pharyngotympanic tube or eustachian tube, connects the middle ear with the nasopharynx, trumpet shaped, 4 centimeter or 36 millimeter in length, two parts, bony part and cartilaginous part. Posterior and lateral one third of auditory tube is bony part we are discussing, 12, 1.2 centimeters, that is 12 millimeter in length, lies in petrous part of temporal bone. It has two ends. Lateral end opens into anterior wall of tympanic cavity. Medial end is narrow. Isthmus, forming the isthmus. Here is the narrowest part. Joining with the cartilaginous part, it is isthmus attached with cartilaginous part. Cartilaginous part, this part is cartilaginous part, you can see here. Incomplete cartilaginous tube. Superior, it has a superior and medial wall, and inferior floor or lateral wall, there is a fibrous membrane. So cartilage is forming the superior and medial wall, and fibrous membrane is bridging between these two ends, forming the inferior wall or floor and the lateral wall. Two ends, apex attached to the bony part, base forming the tubal elevation. See, this part is forming tubal elevation in the nasopharynx. Function ensure equal air pressure on both sides of tympanic membrane. Normally it is closed, opened during swallowing, yawning or sneezing via the tensor and levator valley palatini muscles. So applied aspect, spread of middle ear infection, it is known as acute suppurative otitis media. Otitis media means infection of middle ear. Okay, it may be acute infection or chronic infection. So that's why the names are given. Acute suppurative otitis media, chronic suppurative otitis media. This occurs due to extent of infection from pharynx to the middle ear. Eustachian catarrh formation occur, and tubal block due to enlarged tubal tonsil. Retraction of tympanic membrane will occur if tubal block occurs. Okay, because on the outer aspect there is high pressure of air is present, and within the middle ear the pressure will be low. Treatment is nasal decongestant and inflate the tube. Okay. Now we go to the development of external ear, because different developmental defects we see in the external ear. So external ear develops by mesenchymal condensations. Okay, here it is developing these are the mesenchymal condensation forming the external ear. Hillocks of His. Okay, auricular hillocks. 6 hillocks are present, joining to form the external ear. Next is development of tympanic membrane, outer cuticular. This is very frequently asked in your viva, also important for histology and MCQs. Development, okay, development of tympanic membrane. Outer cuticular layer developed from ectoderm of first branchial cleft, okay, first branchial cleft. Middle fibrous layer developed from mesoderm. Inner mucous layer developed from endoderm of first branchial pouch. See here, outer layer is developed from ectoderm of first branchial cleft, and inner mucous layer endoderm of first pharyngeal pouch. That is tubotympanic recess. Here is development of tympanic membrane. occurring. Tibotympanic recess is forming inner mucous layer, and here is formation of ectodermal development.
Disconnected.
Outer cuticular layer, external auditory
Connected.
meatus is developing, and these two are joining here to form the tympanic membrane. Now, auditory tube, development of the auditory tube, endoderm of the first pharyngeal pouch from the tibotympanic recess, also the auditory tube is developing. Okay.
Connected.
Now we go to the developmental anomalies of the external ear. First is anotia. Anotia is absence of ear pinna. You can see in this child there is absence of pinna, anotia. Next is microtia. Okay, there is pinna will be small, auricle will be small. Okay, different grading is present. Grade 1 it is small but almost normal. Grade 2 some recognizable anatomy. Here the anatomy is abnormal. Okay. Grade 3 small rudiment of soft tissue and no ear canal.
Connected.
Okay. Grade 3 no ear canal and small rudiment of pinna you can see. Grade 4 no external ear and no ear canal. Okay. The patient cannot hear, sound will not enter. Next is melodia. This is low set ear. Okay, low set ear or occurs in Down syndrome or different chromosomal abnormalities. Okay. Next is macrotia. Macrotia is large ear. Okay. So these are the different developmental anomalies of external ear. Next is accessory tragus. Sometimes you have seen like this elevation. So this is accessory tragus. Okay. In front, this part is tragus. In front of tragus, these elevations are accessory tragus. So for ear, we have three parts: external, middle, internal ear. External ear is formed by auricle and external auditory meatus. Tympanic membrane attachments within the tympanic sulcus, three layers, their development, all these are important. Structures in the middle layer and development, all these are important. Auditory tube, so tympanic membrane and auditory tube, you very prepare in details. Okay, it comes as long question, very important. External layer can also come as a part of short question sometimes. So auditory tube, its parts and functions are important. Okay, that's all. Okay, thank you. Any queries?
As we already have discussed this regime on decoding this the X-ray slides or CT or MRI anything, we have a basic principle to follow, which includes going through this particular diagram and identifying this area of the body, which is this particular area. That particular area is focused on, and interpret this particular thing based on the views. So how this particular X-ray has penetrated that particular substance that need to be taken care first, like whether it is kind of anterior posterior or posterior anterior or lateral or any kind of special thing which is there. Now then you have to see for this, is it a general X-ray or anything special you are looking at. So it's a kind of general X-ray plate or it's a special features which are present on him, you have to comment on it. Next thing is that you have to talk about this particular content. You have to take the content based on these particular regions of the body that is showing. Like if it is abdomen, you have to mention its abdomen, thorax, its thorax. And then you have to be specific or more specific on which part of the thorax or etc. etc. Now if you have understood this part of the body is showing in this particular diagram picture, then you have to go for the shadows which is being portrayed here. If it is a kind of like a gray shadow, that means it's a soft tissue, and if it have any bony tissue or not. If you have a bony tissue, that you have to understand what kind of bones are, if it is a complete bone is visible on it or a portion of it visible, that you have to mention or that you have to understand. Then you have to mention about this particular soft tissue which is normal soft tissue which has to be looking like gray shadows and etc. etc. And if it is trapping any kinds of air, which should be taking a complete penetration, that means the air, if it is there, it should be complete black. If the soft tissue is there, it should be like the gray. And if it is a bony tissue, which should be ivory white, that's a kind of like X-ray image in this X-ray, which is the general X-ray which you will be taking here. Now, in this particular neck region, we usually decode this particular X-rays based on 3 views. Like it could be anterior-posterior, it could be lateral, or it could be OM view. In case of whenever you are studying this particular X-ray plates, which are of general X-rays. That means if you are just like going for this general X-ray plate, there has to be 3 views that need to be understood on this particular sessions: anterior-posterior view, lateral view, and a special view which is only restricted for this particular neck and head region. We call them as OM view. We'll be learning what is OM view. So first we are familiar with this particular X-ray, which are anterior-posterior view. That means this particular penetration of the X-ray from the anterior aspects and moving back on the back side, the silhouette or this picture of the shadow of the soft tissue is caught on the back side and in this particular radiogram plate, and that is how it is presented. So this is a kind of X-ray in this head and neck region, focusing on the head X-ray. And once you have understood this particular X-ray, if it is focusing the features of the neck region or head region, you have to be specific, like what kind of view you are seeing in here, which is anterior-posterior view right now, which you are seeing in this particular region is anterior-posterior view, and this particular anterior-posterior view showing like bony shadows, showing some side of like the soft tissue shadows. Bony shadows like whatever the things, skull bones you are seeing here, orbital outlines, nasal bones, and this particular concus, mandibles, and these teeth, and this particular small bones which is present in this face region that is visible, including the maxilla, zygomatic bone, etc., etc. So one by one, you can look into it, they saw like bony shadows, and understand what they are seeing in this particular region. Apart from this particular region, we see the soft tissue shadows which is present on the sides of here in the cheek region and this particular lower upper part of the neck region as well. And inside of this particular mucosal shadows also visible in this particular skygram picture. Now one thing which is kind of like a different than that of this particular bony shadow and this particular gray shadow or black shadow which is present in between, which is this one. So this particular shadow is kind of difficult and different than that of the rest of these particular bony shadows what you are seeing here. These shadows are the artifacts. We call them as artifacts. Here is the artifact made by artificial dentures. That means the person may have some kind of capping on the crowns of this particular teeth, may be made of porcelain or may be made of metals, which is like a metal caps on these particular crowns of the teeth are visible. So these are dentures or artificial artifacts which is visible. So whenever you have something which is little bit different, you have to probe to understand what kind of things we are seeing here, which is like something different than that of this particular bony ivory shadow than that of the pearly white shadows. So like that way you have to just like figure out whatever the contents you are seeing here. Now this particular anterior posterior view, for a clinical purpose, we do that to do or exclude out 2 problems. If you have any fractures related to this particular facial region or the skull bones, etc., etc., that's one thing. Second thing is this region of this face region is presence of these particular paranasal shadows are there. That means surrounding this nasal cavity, we have some additional cavities. We call them as paranasal air sinuses. Those sinuses we have to look for in this particular skygram picture. This particular anterior posterior view, we usually take to see these particular shadows which is present on this particular region. So this is the frontal bone which is seen here. In this frontal bone, on top of this particular nasal bone, you see that this is kind of like a little bit blackish shadow which is coming out here. So this particular impression which is coming over here is this particular impregnated by this presence of this air sinus which is present in the frontal bone. We call them as frontal air sinus. Similar to that, this particular thing which is we have nose, and deep to nose we have this particular air sinus. We call them as ethmoidal air sinus, which is not very obviously visible, but they are present in this particular region. By its side of this nose, we have this particular cheekbone. We call them as maxilla. In this maxilla as well, we see this presence of this air sinuses which is present in here. We call them as maxillary air sinus. So this particular sinuses, beside this particular bony shadows, soft tissue shadows, or anything additional, if it is there, you have to mention through. This is how we are going to talk about any kind of skygram picture: bony shadows, soft tissue shadows, and additionally if you are seeing anything apart from these particular regions. So this is one of the pictures that you have to understand: the AP view, anteroposterior view of this particular skull region or this particular face region. Then we have another place to talk about. This is a lateral view which you also need to be taken care of. So just likewise, this particular anteroposterior view, this is the lateral view, and this particular view is kind of zooming out this particular region where you see this particular lateral view of the head region. So we are emphasizing the head region first, then we can understand this particular diseases or things which is related to this particular neck region. So this particular region is this skull or calvaria which is there. This region is anterocranial fossa. This is a pituitary fossa which is present in here, which call them as sella turcica, which is denoted by the B region, which is lying between this particular, on top of this particular maxilla in a diagonal opposite. Then we have this particular cranial fossa, we call them as medial cranial fossa. And if you are going back to this particular back of this particular region, which is occipital bone region, which is having a posterior cranial fossa. In between this particular posterior cranial fossa and this particular medial cranial fossa, we have this particular two landmarks, which is petrous part of the temporal bone, which is lying in front of the ear opening, external acoustic meatus. This is small black dot which holds this air. That's why this is making some kind of black dots over here. This is the opening which is the external ear has, and in front of that we have this petrous part of the temporal bone which is present in here. Again, whenever you are seeing this particular X-ray plate, they are taken by two purposes. Either pathologically you are looking for any kind of like the bones which is present in here, fracture or any kind of problem, or if you are looking for any kind of like a diseases which is related to extra growth or any form of like a sinus abnormalities, we usually go for this particular region. Now, taking back from this particular region, whenever you are seeing this particular skull as a whole, we usually see this particular thickness of the skull. So you see that we have this particular skull which is present in here and this particular back region. So we call them as outer table of the skull and inner table of the skull. In between this outer table of the skull and inner table of the skull, we have the diploic space. So this particular diploic space, which is kind of little bit like a hollow space, like the bone marrow spaces, that is present in between. So whenever you are seeing this particular fractures in this region, we usually trace this particular region. We call them as outer table of the skull and as well as inner table of the skull. In number of the cases, we have seen the outer table may have fracture, the inner table is not having fracture, or the inner table may have fracture where it may have spared the outer table. So in this particular regard, whenever you are reading this particular radiology of a skull region, do read this particular outer table of the skull and as well as inner table of the skull. And in between this particular region, this outer table and inner table, the space we call them as diploic space, D-I-P-L-O-E-C, diploic space. Now this particular diploic space holds an important part. The reason is that, as I have mentioned, this diploic space is a marrow spaces. Now we may have some of the diseases where you have expansions of diploic space. That means this particular space which has a particular thickness which is normal in this particular region may have enlarged in some of the cases. Like in some kind of blood diseases which you are going to learn in higher med classes, like thalassemia or any kind of like the blood diseases where we need to have a destructions of red blood cells need to be cope up or replaced quick enough. So we have this particular marrow expansion. So this particular diploic space of this particular skull region may have expanded. So this particular diploic space which is lying between the outer table of the skull and inner table of the skull, this narrow region may have expanded, and that need to be like understood whenever you are seeing them. Now from there we are going to talk about some other views which you see that this particular head and neck region, sometimes we just like do this particular neck region in some particular posture. Sometimes it is kind of like taken in the erect posture like extended neck, or maybe just like a super extended neck position like this to figure out if you have any problems related to this particular problems of this particular bone articulations or any kind of artifacts if it is there. So in case of this particular region of this particular lateral view of this particular neck, we may have a normal neck position X-ray that you have seen in this particular previous X-ray. This is normal X-ray, which is neck straight X-ray, and next one you see that the same X-ray which is taken in the lateral view is called them as neck extended position. So this neck extended position is taken sometimes to see closely some kind of like a joint problems related to this particular neck region. So these are the like lateral views and AP views which you see that in commonly, which is common in any parts of the body, whatever the organ you are choosing, like upper limb, lower limb, abdomen, and thorax, we take these particular X-rays. In addition to that, as we have learned, there are so many paranasal sinuses we have in the neck region. We have to take consideration so that one view of an X-ray can hold maximum amount or maximum numbers of the paranasal sinus in a single view. And for that reason, we have developed a view, we call them as a Waters view, also known as OM view. In short, we call them as OM view, which in real words is occipitomental view. That means it is from the occipital bone to the menti, that means to the jaw. So this particular individual, whenever you are taking this particular X-ray, we write this particular X-ray plate OM view, which is specific to understand better this particular paranasal sinuses. And to be specific on the paranasal sinuses, this particular paranasal sinus which is notorious to have these particular diseases, which is known as maxillary sinus. So this OM view, it enlightens with this skygram both the maxillary region or maxillary ear sinuses. So this is what we call them as OM view, mouth open. The person, whenever this particular X-ray is taken, asked to keep this mouth open and extend it in a neck positions, and X-ray is thrown from occipital to mental region. That means it's coming from this particular back side, going from this particular menti cheek region, and the mouth is kept open. You can see this particular cavity of the mouth visible because this particular individual mouth is open. Now in this particular view, we actually explore this particular paranasal sinus which is present by the side of the nose very well, which is the maxillary sinus. So we understand this particular depth of this particular maxillary sinus, whether you have any accumulations or not, and we understand any kind of mucosal thickening if it is there or not. So for example, in this particular OM view X-ray, in this particular individual, we see this particular paranasal sinus, right side and left side, which is maxillary ear sinus, pretty well. And you see that this is a complete black shadow which may be looking like triangular or pyramidal in shadow. So this is a normal healthy maxillary sinus that should be looking like right side and left side. We should have a triangular or a pyramidal shaped shadow. So if you have an accumulation or pus or any kind of excess mucus accumulated in this particular region, we may have this particular region which may be occupied with the mucus. It should be grayed, or it could be not black or occupied like, should be like looking like a white shadows. So we compare this right side maxillary sinus with the left side maxillary sinus and see that whether this particular maxillary sinus is occupied or if it is empty. Empty means its healthy condition is filled up with air. And along with that, with this sinus which you see here maxillary, this frontal ear sinus which is also visible, this ethmoidal sinus which is deep inside is little bit visible along with that. So in this particular view, we emphasize the paranasal sinus view, and in this paranasal sinus view, we actually explore very well this maxillary sinus. So OM view of this particular region. Now, coming from this particular neck, coming from this particular head region, we go down a little bit down with this particular region for this particular neck X-ray. Now, for the neck X-ray region, we usually go for the X-ray of this particular bones which is present in the neck region. So, which is present in the vertebra, we actually look for. So, we call them as a lateral X-ray or AP view of this X-ray depending on the side what you are taking. This particular lateral view of this particular neck region is showing this particular bones, emphasizing or zooming out the bones on the lateral view like mandible or this particular dentures or this particular maxilla from side, or zygomatic bone, and to be specific on this vertebra, we call them a cervical vertebra. That should be completely visible along with this particular TMJ, temporomandibular joint, which is fitting in this particular region. And then we have this particular atlas occipital bone and axis C1, C2, C3, C5, and the spinous process. Every piece of them are visible. Along with that, we can see these particular joints which is present in between them. Now, ideally, what we see this in this region, there are two things. One thing is the curvature. We call them as this curvature which is present in this particular neck region, which is known as cervical curvature, which has to be curved anteriorly, which is a little bit bent over here like this. So you look for the curvature in this particular bones on this vertebra that is holding in here. Second is this particular gaps between this particular adjacent vertebrae which is holding this particular joint. We call them as intervertebral joints. So this particular joint space and this particular curvature we usually look for in this particular lateral view in this particular neck region, along with these particular bony shadows and the soft tissue shadows that you see that along with these particular vertebrae. We see this particular piece of the bone which is present in here, which is a hyoid bone, ossified nicely. Cartilage which is present below here is a thyroid one, which is not ossified, it is still cartilage. That's why it's not visible in this particular picture as we are seeing this. And in front of this particular region, this is a black shadow that is going down, that is esophagus, and this particular tube which is the like a larynx, which is a voice box holding the air, is holding in this particular region and taking a dark shadow over here because of the accumulations of the air. So this particular region or the neck lateral views, we usually look for this particular vertebrae. We usually count the vertebrae. We usually look for this particular how this particular vertebra curvature is there, and as well as we see for this particular lateral views as well, this mandible and the temporomandibular joints and this particular lateral cheekbones or this particular jaw bones, etc., etc., for disease or anything else. And along with that, we see for this particular hyoid bone, if it is present ossified. In case of the elderly individual, we see this thyroid cartilage as well, because that becomes ossified as well. So this is the lateral view. We just like go for this particular X-ray on this particular neck region, and AP view is likewise this same region. Now these are the general views that we are seeing here in the head and neck region. So this general view means you do not see anything special. Now if you want to see something special, that means blood vessel, etc., etc., we are going to throw some dyes and then makes this particular X-ray as a special X-ray. So this particular special X-ray involving in this region, we call them as angiogram. So we are going to see this blood vessel which is going to supply the brain. We're going to see this particular blood vessel which is going to supply the thyroid, etc., etc. Depending on the organ, we are visualizing it. So normally we have this iodine containing dye or a radiopaque dye which is thrown through the arteries, like radial arteries, through the catheter. It puts towards this particular common carotid artery, and even reaching to this common carotid artery, depending on the level, we throw or release the dye. So once the dye is released, then we take this particular picture, or if it is maybe a still picture or maybe a video picture, we take it. So for example, we have this particular carotid artery. If you are going to see this particular carotid artery, so we usually take this particular carotid artery, go for this particular common carotid artery till the bifurcation point, and then release this particular dye and then take the pictures afterwards. So this particular carotid angiogram, you see that this is the anterior-posterior picture view of one side. So this is the side which you're seeing here. One side is visible of this carotid artery which is going down, going to the brain and splitting into smaller branches and supplying this area. Once you have this particular picture, we just like zoom it and see that if you have any minute blockage in them or not. So any kind of like a blockage, we usually look for this particular arteriogram, or any kind of like dilatations, we call them as aneurysm, which is common in this particular region as well. We look for this particular thing. So this is a kind of special view that you see this particular carotid artery, how this particular carotid artery and branching into different region into different views. So if you have a bilateral view, it should be looking like that. Both side carotid artery taken with the dye and thrown out and seen. So you see this is a carotid artery, internal carotid artery getting inside this particular brain and then making a bend over here, going straight and then splitting into this particular middle cerebral artery and this particular anterior cerebral artery. This is the vertebral artery, right side, left side, joining together, making this particular basilar artery. So this particular entire brain arterial system is analyzed over here with this particular radioactive dye thrown into this particular blood system and taking this particular series of picture and videogram even. So we can analyze this particular region just like likewise we want to see this, especially this particular circle of Willis. We know that that particular region is prone to have these particular aneurysms and diseases and ruptures, etc., etc. So if the individual have got kind of like a propensity for cerebral accident or stroke, usually go for these particular angiograms to see any vascular region which is weakened by this aneurysm or not. So this is a kind of special X-ray of the carotid angiogram where you see this particular dye going through and this particular series of the pictures is taken. So this particular picture, you seeing this particular blood vessels, that makes this particular thing a special one, because in a normal X-ray you cannot see that. This one is made through seeing this because of this particular radioactive dye. So these are the two entities that we need to understand: general X-ray, which is not going or not showing anything special, and special X-ray, which is if it is showing something special like any vasculature or any kind of like a special part of the organ if it is visible. So this is like the carotid angiogram in this particular head and neck region that you have to know and understand. What do you mean by the carotid angiogram? That means visualizing the blood vessel in the cerebral region, and if may be one-sided, it may be both-sided, it may be anterior carotid arteries, posterior carotid arteries, or maybe this particular circle of Willis, depending on whatever you are seeing here. And it may be just like a general X-ray, lateral view of the neck region, showing these structures, or maybe just like the OM view, which may be showing the paranasal sinuses, or maybe just like a lateral view of the head region or the anteroposterior region of the head region, showing the structures likewise. So this is what we need to contain here: three pictures of this particular head and neck region: anteroposterior view, lateral view, and OM view. OM view, occipitomental view, also known as Waters view. If you cannot remember this, OM view is good enough, occipitomental view. And this particular view is done to explore this particular paranasal sinuses, and especially if you have to mention any of this paranasal sinus which actually been visualized very well is this particular maxillary sinus. That is most notorious for us because the diseases of the maxillary sinus is more common, most frequent, and very difficult to treat. That's why we need to see this particular thing. And apart from that, we also do this particular lateral view to explore this particular joint on this particular region. We call them as like temporomandibular joint. So this particular mandible which ends up in this particular region, which is going to see this particular TMJ or temporomandibular joint. If you have a dislocations of the temporomandibular joint or this diseases of this particular temporal region need to explore, we also do this particular lateral views. So this is all. Do not make this particular thing complex. Remember the views, name of the views, and what are the things. That is the same logic. What you are seeing, soft tissue and bony shadows, and apart from soft tissue and bony shadows, if there is any artifact there or not, that means something abnormal out of that. That's what we see in this particular picture. We have this denture which is super visible in this particular region. So this particular denture is fitted with porcelain or any kind of metal thing which may be plugging and showing super bright over here. So that has to be a little bit like abnormal. So you see that few dentures are there, this is there, then you have emptiness over here. That means this particular teeth are fallen, and this particular individual, this particular teeth which is close to this particular region which is lying over here is that maxillary teeth, is that particular teeth which is on the back side. Molar teeth are there, and unerupted tooth is there as well. This is the wisdom teeth which is not erupted yet. You see that this particular teeth, we call them as impacted tooth or something like that. So this is how we interpret this particular X-rays. So that's all. Oh, I forget to mention about this particular impression. You see this particular impression, this region, and which is highlighted over here. This is the dens, like C2 cervical vertebra, that projections which is vertically projected over here. With this particular extended neck region, we can see this particular dens are there. Sometimes we have a fracture in the dens. So that particular, or some kind of like hairline fracture or diseases or thickening of the dens is there. So this particular dens can be seen in this particular extended neck pictures or extended neck X-ray, which is looking like a vertical pillar in this particular region, in this particular anterior column of this particular vertebral region. So that is all for these X-rays on the neck region and this head region. These basic things need to be learned. That's all. Thank you.